For Health Connection Radio, this is nutritional biochemist Jay Foster, sponsored by Body Chemistry Associates, 1-800-CHEMIST, 1-800-243-6478, and the Body Chem programs of testing. Today we want to talk about moods and emotions. Can anxiety and depression be actually triggered by imbalances in your blood sugar, fluctuations in your blood sugar, your brain blood sugar? Well, there's a lot of evidence that says that it does, and that's been our experience at Body Chemistry Associates over the last 36 years now. I'll point to an old citation first. Relative hypoglycemia, which just means a type of blood sugar imbalance that can lead to type 2 diabetes, as a cause of neuropsychiatric illness. This is back in January of 1966. And they say that people that they found with this blood sugar imbalance, psychiatric symptoms of depression were found in 60%, anxiety in 50%, irritability 45%, insomnia in 50%, fatigue, tiredness in 67%, and headaches in 45%. I mean, the blood sugar fluctuations really do cause symptoms, and most physicians are not trained, I think, adequately to recognize what are causing those symptoms, and rather than just treating the symptoms with an anxiety relieving agent or an antidepressant or headache medication or Ritalin or whatever the drug that's used to treat the symptoms are, it's not getting to the source of the problem. Well, how can blood sugar fluctuations affect moods? Well, we've had a lot of experience with people coming in for what they consider the treatment of anxiety is. And, we look for nutritional approaches and dietary approaches to people's symptoms. I'm not a medical doctor, I'm a biochemist. So when someone has symptoms of anxiety, is it really because the world's getting to them, or is it their internal world, their brain chemistry that's not doing well? And one factor is that if your blood sugar starts to fall down, can fall down for two reasons. One is you don't eat on time. You go 3, 4, 5, 6 hours, and then you forget that you didn't eat lunch, and then the bottom drops out. Or you may eat dinner at 6 p.m., not go to sleep till 11, and then you have the whole night to have your blood sugar fall. Now, when your blood sugar falls down, one of two things happens. If it goes to 0, you pass out and die. Or your brain sends out a rescue, an emergency, from the adrenal glands called adrenaline or epinephrine. And the adrenaline does a good job of bringing your blood sugar back up to the safe level for the brain and the body, and then the emergency's over. But the trouble now is, now you got adrenaline circulating around for no good reason. It's not like someone's pointing a gun at your head or you almost got run over by a car. All you had was a blood sugar fluctuation, but you were riddled with anxiety. And some people get riddled with depression first, but riddled with anxiety just because your internal adrenaline is being pumped sometimes 4 or 5, 6 times a day as your blood sugar goes up and down and up and down and up and down, a roller coaster crash. Maybe due to your diet, maybe too much sugar, maybe not enough protein, not enough fat, maybe chromium deficiencies or magnesium deficiencies. That's why we do our tests in the Body Chem program at Body Chemistry Associates, and we've been doing it now for 36 years. And if you'd like to find out more information on our Body Chem programs and how we might work with people with mood imbalances and how it might relate to blood sugar imbalances, which we have very good success with, you can give us a call. It's 1-800-CHEMIST, 1-800-243-6478. On the web, 1-800-CHEMIST.com. We'll have future audio broadcasts on various different subjects available for you. And if you would like any subjects covered, please give us a call. 1-800-CHEMIST on the web, 1-800-CHEMIST.com. This is Jay Foster for Health Connection Radio and Body Chemistry Associates saying thanks for tuning in today, and we'll talk to you on a future podcast.